Well, you're welcome. Thank you, all. I'm glad everybody was able to join us this afternoon. As said, my topic here is on using alternate item formats for the purposes of assessing students. Um, Let me give you a little bit of background on myself, just so you know who I am and a little bit about me. I'm a department head in our health sciences area at Lindenwood University. I've been involved in paramedicine since the early to mid 90s and been teaching EMTs and paramedics since about mid 90s to early 2000s. I serve as the program director for our bachelor's degree paramedicine program. Um, I have a number of master's degrees. One of them is in education, where I focused really on measurement and statistics. So I was really interested in testing and measurement. And I've even done doctoral work in psychometrics, where I was interested in studying computer adaptive testing and standard setting. So how we determine cut scores. Besides being a paramedic, I'm also a nurse and a nurse practitioner. I do have my MSN focusing on nursing education. So studied a little bit more on writing exam and items for the purpose of assessing healthcare individuals, and have served as a program director for a bachelor's and master's program in nursing. I've written for the National Nursing Exam, the NCLEX, a number of times, so I've had an opportunity to actually write professional exam items. Hopefully they have made it through all of the screening processes, and some made it onto the actual exam. And then this is not my first talk on exam development and item writing. And I enjoy talking about this and helping people learn because most people don't get a lot of education in exam development. The goals of today's presentations are really to talk about the non-standard items. Most people are familiar with the multiple choice items that we put on an exam, but I want to talk about various alternative item types. These include multiple response items, fill in the blank, charter exhibit questions, ordered response, hotspot questions, and then some other alternative formats that mix some of these together. I'll talk briefly about scoring methods, because when you use these alternate items, it's a little bit more than just right or wrong, although it could be. We'll talk about some of the pros and cons to some of these item types. And then lastly, we will address how do we assess knowledge and understanding. And here I'm using the word knowledge as kind of a lower level items, and understanding is kind of higher level items. And I think that these type of questions offer you the opportunity to test different levels of knowledge and understanding in students. What we're not going to cover, and these are topics of other discussions that are worthy and appropriate to exam development. One is how to write an exam. There's a whole process about exam development and blueprinting and determining what your goals are, what type of questions you're going to put on there. I'm not going to go into writing an optimal item, although I try to use optimal wording in some of my samples. We're not going to get into stems and distractors and different types of answers. I'm really going to talk more about item types rather than, what is the best way to phrase that, although we will make some mention of that. Obviously, item analysis, the statistical analysis after someone's taken an exam, and setting cut scores are other things that are relevant to testing, but not going to be covered here. I do mention them along the way, but I really want you to be aware of what we're going to cover, and then what other things are really relevant in the exam writing world. So let's start with an example. Here's a question I actually found on Facebook. This is a question I think someone was advertising for a study prep program related to critical care, I think. You're called to, you respond to a call in the long-term facility for an elderly patient. They give ABG values. You interpret the blood gases. And then the question is, a normal PaO2 is between what values? And when I look at this question, I mean, there's so much I can do with this. This is why I picked it, because we can actually analyze this question about the good, bad, and ugly for it. We can talk about what type of item type it is, what the variations are if I were to change the number of answers answers, what level question is, how would we score this item. I think there are some goods with this question, but there's a lot of bads. If you read the scenario, you can see that all of the information provided up front, like the ABG values, is really irrelevant to the question. The question itself says the normal PaO2 should be between. And then, I mean, I can go ahead and actually cover up this whole part. I can X out the whole top part of that and still answer this question just by the bottom. So really, I have a knowledge level question with a big scenario that really is irrelevant to it. And this is an example of an item that really has a lot of extraneous information in there that's not relevant to the question being asked. This item type I will talk about in alternative items. Here it is a standard multiple choice, but it could be like a fill in the blank. And we'll talk about the pros and cons of giving these type of answers. As most people are familiar with, the multiple choice exam typically has 4 choices, A, B, C, and D. Although we could do A, B, C, or we can do A, B, C, D, E. We can do 5 choices. There's debate out there about, how many items or answers should be on a multiple choice question. Is 3, 4, or 5 a better number? There's whole statistical research out there that shows that really, if this is a 3 choice versus a 4 choice, you're really not going to change a lot on it. Adding a 5th choice, some people are like, well, it makes it harder. Not necessarily. There's a lot of other things to this question that would make it better than worrying about 3, 4, or 5 answers. As I mentioned, Bloom, we're going to talk about that here in a moment in higher order questions. The level of this question is just basic knowledge. Do you happen to know what the normal PaO2 for blood gas is? And if you do, you'll get this question correct regardless of the scenario. And I assume that this is scored as a right or wrong. How most multiple choice items are scored as, did you get it right? Did you get it wrong? By selecting the correct answer. Most people are familiar with that, but there's a lot that can be talked about that. We're going to jump into, how are we going to use these items to help us evaluate individuals, and what is knowledge and understanding all about? So I present to you what I'm guessing many of you are familiar with, is the Bloom taxonomy. And some people are not aware, that this was updated a number of years back with slightly different terminology. In 1956, Benjamin Bloom had created this with these nouns: knowledge, comprehension, application, etc. I'm sure many people learned it that way. In the early 2000s, this was updated to more of a verb, remembering, understanding, applying, analyzing, and many people have learned to write items with action verbs. So I wanted to just kind of give an introduction to that so that people are aware that when I'm talking about higher order items, I'm talking about the upper end of the pyramid. These old terms, analysis, synthesis, evaluation, are kind of higher order questions, and then lower order thinking questions is just a factual knowledge comprehension type questions. I think there's value for both of them on exams. I think we need both of them. There are relevant times where lower order questions are very, very appropriate. And then we try to push towards higher order. I think most people, when they write exams, can write lower order questions and knowledge. We can create a lot of factual questions easily. It is a little bit more challenging to write a higher order question. And we'll talk a little bit about that in context of these alternative item types. In relation to items is knowing how I'm using the test or the evaluation. Is it for assessment, a formal or informal assessment? Are we trying to give feedback to the learner? Is it a practice test? Is it a learning quiz? I use a lot of learning quizzes in my class that, you go home and take this quiz on your own. And this is just kind of my proof that you've read through the material and have some familiarization before you come to class. Not a big part of the grades on it, but the quiz is designed for learning purposes and not really an evaluation or assessment. I have some students who come to me after National Registry and say, I struggled on the exam. So I will put together diagnostic exams, and I will put together and say, here's a little quiz I want you to take, and it helps me identify areas of strengths and weakness. Again, I can use alternate item types to do some diagnosis. And then obviously formative and summative feedbacks are out there. or formative and summative testing. Am I doing a unit exam? Am I doing an end of course final? So knowing when to use these items are appropriate, and realize that they will impact your scoring. So if you say, hey, everybody must get a 70 or above, well, some of these alternate item formats, when we get to scoring, you will find challenges that normal 70 or above to pass might be impacted by alternate items. So I'm going to give you some samples of this. Again, the focus really is not here about when to use these exam items. It's more about, what these item types are, and then realize they can be used in all of these settings. So let's kick into, the core of this presentation. And this is the item types itself. The way I'm going to present this is each item type, I'm going to give you a little background on the item type. We'll then give some samples. We'll talk through some of the samples. We'll talk about scoring and some of the considerations with it. And then we're going to go through about the 6 or 7 item types that I've said I will present on. And at the end, then we'll open it up for question and answer and more dialogue and discussion. I'm going to start with the multiple response item. The multiple response item is not much different than a multiple choice item, with the exception of, instead of choosing the best answer or the one answer, the candidate gets a chance to choose multiple answers. So it's often used when you have more than one correct answer intentionally, and it's written that way. Typically, if you gave a multiple choice exam and said all that apply, well, sometimes you could say, instead of all that apply, which is not really the ideal way to write an exam question, you can make it a multiple select, get rid of the D option of all that apply or all of the above, and then make it such that they can select all the correct answers. And usually we don't make all the correct answers every checkbox, and I'll show that in a minute. We can identify the number of correct and help the candidate out, or we can tell them that they can select all that apply. We can grade that as either correct or incorrect, partial or non-partial. Credit model, these are often referred to as multiple items or multiple select. I like to make them equivalent to, instead of writing a lot of true false questions, by using a multiple select item, I've actually had them evaluate all of the answer choices, and they say yes if it's true and no if it's false. So in a way, I get a chance to maybe evaluate 5 multiple choice questions, true false questions, in a single multiple response item. So let's take a look at an example. All right. Here's a question I just threw together the other night. Felt like it was a relevant question you might ask somebody at the very beginning. Which are the following EMS professional titles during the night per the 2019 EMS scope of practice model? And then I bring through EMR, EMT, AEMT, paramedic, and I even use some of the old terminology, EMT intermediate, EMT/paramedic. And in this choice, notice here, instead of selecting one answer, they are checkboxes. So they can check the number of correct answers. What I have not divulged on this example is how many answers are correct. So this requires somebody to basically evaluate, is this true or false? True, check the box. True, check the box. This is not a title. False, I won't check the box. So in a way, you can see 1, 2, 3, 4, 5, 6, 7. This could be treated as 7 true false questions put together in a single item, if you wanted to. Instead of saying a EMT is a true or false, I basically asked that by this checkbox. All right. Let me look at some alternates to that. All right. This is the way I standardly will write my exam. Notice at the very tail end here, I said, choose all that apply. This makes it a more difficult item because I have not delineated to the candidate how many answers are correct. So they might think that, all of the answers are correct. Some of them, 2 of them, 5 of them. Usually a multiple select item is not, there's only one correct answer. So a good test taker would realize that there's not going to be one checkbox, and usually it's not all the checkboxes. So they know it's some variation between 2 and 5 or 6 answers. All right. There's some literature out there that says, choose all that apply is not always the best way to evaluate. And on a high stakes exam, you're more likely, instead of saying choose all that apply, you're more likely to see this option that says choose 4 choices. So now we're not tricking, I don't really say tricking the candidate, but in this case, we're actually telling them that there are 4 correct answers. What makes it more challenging is they have to know what 4 are the correct answers. I think somebody's more likely to get this question correct with knowing there's 4 answers than the previous question. Go back to the previous question where it says choose all that apply, because it's a 2-step procedure that they have to first understand and know the answers for every one of them, and then delineate whether or not they meet the criteria. The National Registry has started in adding these type of questions to their exam. I think they call them their technologically advanced items. And from what I've heard in their presentations, and again, my talk is not about National Registry per se, but this is an item type that you might see a student showing up. My understanding is they're going to show you the correct number of choices and say choose 4. And then there's some rules out there defined to standardize that. And if there are 5 answers or 5 selections, from the choices, there may be 3 answers, and if there are 4 correct answers, there will be 6 choices, or something to that. There's a pattern written into their test blueprinting guideline. Again, I use these exams for my own purposes, so I don't necessarily have that rule, but in this case, I have told the candidate that there are 4 correct answers, and they have to know which 4. All right. Then we get to, well, how do I grade this item? There are a number of grading metrics out there. One way to grade this is say, hey, you either picked the correct 4 or you didn't. The question's either right or wrong. And to do that, you have to be all right, or otherwise you're incorrect. If you pick 3 of the 4 correct, you would actually get no credit for that. There's also what they call a partial credit model out there, or grading, where you can give credit for all the correct answers. You might deduct points for incorrect answers. Because somebody might just check every checkbox and go, well, if I throw enough darts at the dartboard, one of them's got to hit. So, you can do that. I think the SAT, when I was in high school, did that. There was a strategy behind the test of if I didn't know the answer, I didn't choose to answer it, because if I did choose it, I might lose points for getting incorrect answers. And you have to take a look at how difficult this item is. I think the first example I presented to you, where it says choose all that apply, is a more difficult version of the item than choose 4. Students aren't used to that. If you're going to grade this as all correct or all incorrect, and they choose 3 of the 4 correct, and you told them they got it wrong, expect an argument because students aren't typically used to this item. And when it's scored as you were right, but partly right, not 100% right, therefore you get no credit, does become a difficult thing for some students to swallow, because they're not very used to having that grading. A lot of pros and cons, a lot you can do with that. I will often I'm going to go back one more question. I will often make a question like that, maybe weighted. Instead of a 1-point question, this might be a 2-point question or a 3-point question. Or if I really wanted to be like for true false, it could be a 4-point question where they get 1 point for each correct answer. So there's a number of different ways I can actually score that in terms of points. All right. The next item type is the fill in the blank. I think many of us are familiar with the fill in the blank from our days in K-12 school. And then we get into college, and you often find much more of the standard multiple choice. But we're going to go back to fill in the blank where there's short answers. 1 to 2 words you can do, 1 to 2 sentences. I think the fill in the blank is very good for calculation. So if you want them to calculate a drug dose, for example, or show they know it, instead of giving them 4 choices with the answers, you actually have them calculate and then put that value in the box. Very similar to a math class where there's never, I don't think I've taken many math exams that I have a multiple choice exam. Very typical in math, show your work and then get the right answer. Physics was the same way. I find fill in the blank works very well with graphics if I wanted to identify or label. So if I'm teaching anatomy and physiology, I might end up by using fill in the blank to free form in verbs or terms. And then I could do multiple blanks. So let's look at a couple samples. The first one is the single blank. Blank milligrams is the dose of epinephrine for adults in cardiac arrest. Notice I've added to the end some instructions. Record your answer with a whole number, no decimal. So in this case, it'd be 1 milligram, and I would expect the person to type in this dialog box the number 1. If you want some of the systems to grade that, some of the computer software will auto grade, then you're looking for the number 1 and not 1.0 or 1.00 or ONE. So giving instructions, if you're going to have a system automatically grade that with valid values, you're going to have to delineate what that is. And I've told the candidate to record your answer as a whole number. All right. Therefore, they will get it wrong if they were to actually put 1.0. I could go ahead and manually override that, but they did not follow the directions. Here I said whole number. The multiple blank item, here is one that, you know, most people would be able to fill out. Roses are blank, violets are blank. So the keywords here, roses are red, violets are blue. So there would be valid answers that would be well recognized and understood and fill in the blank. I think there's value for this because I'm not presenting a candidate with all the answers. You know, usually in the back of an ambulance, students do not get a chance to say either A, this patient's having an MI, B, they're having a PE, C, they're having COPD. So we would often say that the fill in the blank is, what do you think is going on with the patient? And they don't have multiple choice. Here they have a fill in the blank. When it comes to scoring these items, we could also score them as incorrect or correct. Did they write the right word in there? What if they used an alternate word? What if they capitalized? So there are some of those things that have to be manually graded associated with that. But the correct incorrect is usually you got the word 1.0 or 1 correct for that drug dose of epinephrine. A partial credit, let's say roses are red, violets are green. I could either mark that as completely wrong because I didn't get the statement correct, or I could say they get 1 point for red and 0 points for green. In that case, I can end up by saying it's a 2-point question. Each block's blank is 1 point each. So I have the opportunity to do both partial credit as well as full credit grading on that. I could weight the items. So the roses are red, violets are blue could be a 1-point question, or it could be a 2-point question. And it's up to me to determine how that item is weighted. I think the roses are red, violets are blue, even though there's 2 answers to it, might be a 1-point question. Each part is 0.5, or all right or all wrong. I probably would not give that, you know, a 5-point weight compared to another question that I put on an exam that's 1 point. As I mentioned, do people follow directions? What happens if they entered a 1.0 instead of a 1? Or rounding. Let's say you have to do a drug calculation and say, calculate how many milligrams you would give. And they ended up by putting 2.5 and it should be 2.49. Well, did your instructions say, you know, round to the nearest 100 or thousands or tenths? So you've got to be very, very clear with those rules. When I was in nursing school, we would be either right or wrong, and you had to match exactly the rules of rounding as specified. So you need to include those expectations upfront to students on multiple fill in the blank questions. Otherwise, they're going to give you a multiple set of answers that you're going to get quibbling discussions with, and that's not going to be valuable because it takes away from what your purpose of that evaluation is. One of my favorite items is the chart graphic item. And this can be used with a variety of other items. So I can use it with a multiple choice, fill in the blank, short answer, or true false. In this case, you upload an image, table, chart, graph of some nature, and the candidate will refer to that chart, table, or graph and answer a question relevant to it. We're pretty commonly familiar with that in terms of EKGs. We might give them an EKG and ask them to identify the EKG and look at that. And I teach a health assessment course that I actually use this item type a lot. So My examples here are some of the items that have come up in my real exam. I've used from the textbook a photo, and they're assessing the ear. So I said, what is this condition? And I left a fill in the blank. So they have to fill in the dialog box to identify what this condition is. Or in this case, I gave them a photo, and we're talking about how would you describe a person? So how would you document the appearance? And then I also said in one word. So I'm looking for them to use some keywords that we had taught about explaining what this person is. I'm not looking for a long narrative. I'm looking for one word that depicts the appearance of this individual. Similarly, this came from an exam. The condition is a result of what endocrine problem? So again, now they have to identify what's going on with this patient, look at the picture, but now it's not identify the condition. In this case, it is relate the condition to an endocrine system. So in this case, I would expect that they would talk about a thyroid issue. And I think this is great use of graphics and how I word these questions, very open-ended for these dialog boxes. But I can mix that with a true false. So in this case, I have a photo and I said, this condition warrants immediate ED evaluation. All right. And this is for a paramedic. You know, would I consider this a true emergency or not? True or false? And to get this correct, I mean, you could guess. It's a 50-50 chance if you don't know what's going on. But the reality is you have to look at that eye and then determine in my mind, what do I think is going on? And is that a true eye emergency or not? And then it's marked as true, false, rather than saying, identify the condition or explain it. Matching. I think we're familiar with matching, although they're a little bit more difficult to do. I think matching are really good for linking items and terminology together. In a way, I can put multiple choice items together into a single question by doing matching. However, they become very complex quickly. We can get overload. Students can get very confused. It becomes difficult to grade if I have too many choices and too many options. But what I find in writing these questions is I can not always make matching a perfect match. So sometimes I'll give 5 words, but instead of giving 5 answers, I'll give 7 answers, which means if I gave 5 words and 5 answers, people will process of eliminate, not know 1 or 2 and make guesses. But when I give 5 words and 7 answers, you can't do process of elimination and rule out other answers. So you're not benefiting from good exam skills. You're benefiting from evaluating knowledge. Do I really know that information? All right. Here's a matching item that I have on one of my exams. Match the word and definition. So I had, you know, erythema, alopecia, a furuncle, a vesicle, and a wheal. These are terms that they should have learned along the way. So now do they know what the definitions are? I mean, this is something that if somebody did flashcards, they would know what these terms are. But when you look at my drop-down list, there are 7 choices here. All right. In alopecia, you know, you would pick the baldness and hair loss. All right. But realize that there are some other options on here that are no longer relevant to any of these 5 choices. They are definitions of some other things. So a 5-to-5 match is a lot easier, and we're more commonly, I tend to do the more difficult 5 words, 7 choices. Again, it's not overly complex. If you were to do a drop down for vesicle and wheal, you would still find these same 7 definitions. All right. So this is a nice way. Again, this is more of a knowledge question. So the purpose here is I want to know that people know vocabulary and understand what's going on and can identify things. So it's not necessarily a higher order question, but in a way, I've asked a lot of things in this one question, and I can actually evaluate a lot of information in a single item. All right. When it comes to grading it, you know, I can, since it's a single item, I can grade this as 100% correct. Did you select all 5? More often than not, I will actually grade this as a 5-point question, and you get 1 point for each correct selection. So you can do number of questions. You could also sit there and say it's a 3-point question, and each correct answer is a fraction, so that you don't overweight this question, because it's really not a hard question if I know that fact. But I don't want to give 5 points away to just everybody because I know some knowledge level. So I can weight this question however I want. It can be 1 point. I don't think that's fair to compare a 1 point question to any other multiple choice or true false. But I don't want to give it the weight of a 5 point question because all it is really, some basic facts. So maybe I make it a 3 point question. And then I can go ahead and weight each selection. Again, not often used with high level items, although it could be, but be careful about making it too complex, making too many choices out there. All right. Ordered response items. These are often used for ordered things, steps in a procedure, specific orders, historical items. If I were to be a history teacher and in a certain junior high, I might ask people to rate or order when different states were admitted to the Union. So New York was in before California. Where was Missouri and where was Texas in terms of the time frame? Typically, it uses all the choices. So unlike the previous exam item where I had more choices and answers, here I typically have a procedural order and I just have to have them order it. We often call this a drag and drop item. Typically seen on computerized items, it's a little harder to do on a multiple choice. Although we did see that you can actually do a multiple choice question by asking for sequencing. I think they're complex. It's like 1753 is the order, or 3792 is the order. And that becomes very confusing. So the drag and drop makes a lot of sense. And here's an example of a drag and drop or an ordered item. There are 6 steps in this procedure. And what a candidate would do is they would actually drag the steps of the procedure from top to bottom over to the right. And then they could go ahead and order in which order we would actually place the catheter. So in this case, it's a procedure like placing a Foley catheter. And we would actually have the person know the correct procedures. We often evaluate this in a skills lab, but it can be asked on a knowledge exam to show that they know the facts. And then the demonstration would be in the lab. Typically, this is graded as correct or incorrect. Is the sequence correct? If you put all 6 items in the right sequence, you got the points. And if you did not, you could do a partial credit model, although I don't really see that commonly done with it. But I could see some value in that in maybe certain procedures like backboarding. And the last step is securing the head, or checking pulse, motor, and sensory function before and after splitting. So did I at least put at the beginning, check pulses, motor, and sensory before I applied the splint, and at the very end, checked it at the end? And maybe I'll give some points on a partial credit that show that they knew to do that, even though they didn't do the procedurals of the splitting in the correct order. Again, maybe not high items, but these are often important topics. All right. I could see this with intubation, although you got to be prepared for some debates. Be clear on the correct answer. So I think about ET2 verification, and I've heard people debate this. Do I listen to epigastric sounds first and then lungs, or do I listen to lungs before epigastric? Well, if I'm going to create that as a sequenced ordered item, I better darn well make sure that there's a clearly one best answer. Because otherwise you're going to get a lot of debate, particularly when you mark the item wrong and they said, I listened to epigastric first because that's what my lab instructor told me. And you're like, well, the correct answer was lungs first because that's the way I taught you in class. You're going to have a lot of debates, but I think it's a valid item for a procedural type of step. Just make sure the steps have clear delineation of what is correct and what is incorrect. The hotspot item. Hotspots are really good for identifying areas on images. So EKGs, if I were to look at an EKG and say, hey, show me the P wave, or show me which segment you consider T wave inversion. Assessments, if you're listening to heart sounds or lung sounds, where do I place my stethoscope? Anatomical landmarks, like the angle of Louis, might be valid for placement of electrodes, or point to the midclavicular line, or where would I place a needle if I had to decompress the chest. Typically, it's not for fine delineation. It's got to be a rough, close estimate. You have to mark off a region. What is an acceptable place to mark that you consider close enough? Because it is not something that on an image you can actually say this is purely the right spot. And I'm going to show you the using a multiple choice version of this instead of a free form version in just a moment. All right. So let's take a quick look at an example. Here's the question. In performing a physical assessment on an adult male, identify the area where one should place a stethoscope to oscillate heart sounds of the tricuspid area. All right. And in this case, they would have a cursor. The X is already marked here as the correct answer because I've actually took a screenshot with the correct answers, but they could put an X wherever and have a cursor and they can click. And then in defined on the answer key would be a little region here that would be considered valid. All right. So right now the correct answer is marked, but the candidate would actually have a free diagram of the lungs themselves and the ribs. And they would have to check where they felt that was assessed for. Here is a hotspot variation that I did find from, I think a K-12 setting. It says 3 countries are visible from the summit of Everest. Put a hotspot mark on each of these countries. So this is a multiple answer item used together with a hotspot. And the correct answers are already depicted here. You see India, Nepal, and China. And that's what it would be is you would select multiple areas on a graphic. I find a way that you could vary this, and you could actually create a multiple choice version of the question by actually creating hotspots. All right. Let's say there are 5 hotspots here, 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 and here. And you could also then say, select all of the hotspots, and they would just check the check boxes for each of the check boxes they felt that were relevant. So in a way, you could do a hotspot, but a variation by actually already pre-marking hotspots and then having them pick from the hotspots the correct answers, which I think is a really fascinating way to kind of mix together some of these alternate item formats. All right. Again, we could grade this as correct or incorrect. Typically, that's the way it is. There's a valid region of where the hotspot is marked. And if they're in that region, they get the point correct. And if they're not in that region, they do not get the correct point. A lot easier to do with a computer as long as you have software that's capable for it. And many of our learning management systems have started adding this feature. And I think on paper and pencil, it's really easy. If you're to do a paper pencil exam, you just print off the graphic and then you can actually manually look at where they put the X on a paper and pencil. The considerations you have to do is how precise do I need them to be? If I want them to go ahead and show me where a needle went in the chest for a needle decompression, how precise do I need? Does the mark need to be between the 2 ribs correctly? How well is their midclavicular line or their axillary line need to be? And how well can you do that on a 2-dimensional diagram? And are your instructions very clear? Do they know what's expected of them? Are important considerations. All right. So let's talk a little bit about how do we take some of these item formats and move them into a higher item format structure. I go back to this diagram that I really liked, and I just kind of created a variation for it and said, hey, on this diagram, we've actually named the countries: India, Nepal, China, Bangladesh. But I could easily take this graphic and remove the names of the countries. All right. So now, instead of telling them the names of the countries, would they know the name of the countries? All right. So do they happen to know a fact that says, Everest sits between Nepal and China? So the fact that I have got the word Nepal and China there means that I already know this is Everest. If on the other hand, I didn't actually know that this was Nepal and China, then I would actually have to know that one fact first. So I could easily see getting rid of Nepal, China, Bangladesh, India on that. I could also say, how many correct answers do I want? Choose 3, choose 2, choose all that apply. I could not call this Everest. Here I've already told them that this is Mount Everest, but I could use this diagram and said 3 countries are visible from this summit. And then they would have to actually know that this is Mount Everest as the summit, because that's where Mount Everest is. What is the students expected to know to get this question right? So I can make this simply knowledge information all the way up to a much more involved question that says, I better understand what this map is, understand the surrounding countries, understand what this peak is, and then be able to answer that question. And that becomes a multi-level item in the fact that it requires higher level thinking to really be able to apply those concepts. And that assumes that students understand the topology of this map. They understand what countries are on the map. They need to understand this is Everest on the map. And that's the way I would probably take a question like this if I was teaching that discipline and trying to create a more complex item to test that knowledge. You're probably not going to find something like that on a licensure exam, because usually you want to test a single construct at a time. But sometimes if I'm evaluating or diagnosing something, this would be a great diagnostic type of exam item to see where the weakness is. The weakness of, do they know the mountains? Do they know the topography? Do they know, that Mount Everest is one of the highest peaks? What facts do I want to make sure that they're aware of? All right. Let me bring it over to EMS. Let me talk about what I do in some of my classes. And I use a case study scenario approach to get some of these higher order items in there, where I mix some of these alternate item types in there. And I use both high and low order items throughout my exam, because sometimes I want to know that they know a drug dose and a route. So if I were to ask a question on anaphylaxis, I would still want them to know it's 0.3 of epinephrine, 1 to 1,000, and it's IM. So that's just really knowledge. I mean, most people know that fact. But to understand the pathophysiology of allergic reaction, it's a little bit more depth than just knowing the 0.3 of epinephrine. I will often use short answer or short essay type questions, and I will do weighted grading of items, and I will use multiple item formats together into a question. So here, I know it's a pretty wordy slide, but here is one of the cases I presented to the students. Dispatched to a 74-year-old unresponsive woman. Here is your history of present illness. Here are your vital signs, and here's your physical exam findings. And again, I gave them stuff that's relevant, although I didn't overwhelm them. But the fact that we actually have doll's eyes going on and GCS5 are relevant, and a Babinski sign detected, they need to know what that means. And then there are other irrelevant. Abdomen was soft without any guarding. So there's some things that would be relevant. I'm indirectly telling them these are things you should be assessing on this type of call anyway, but they have to be able to interpret all of this data, all right, and then move into some exam items. And question 1, for example, was this case presents with bradycardia, hypotension, and cardiovascular collapse. In the above findings, so they refer to that instead of a graphic, in this case, the case, the patients have symptoms that include fatigue, and I draw their attention to certain symptoms. And I do tell them that these are subtle signs. So indirectly, I'm teaching through this, but also evaluating it. Knowing these additional symptoms, what life-threatening conditions are present. So again, this is asked on my real exam as an open-ended item, a free-form text response. But I easily could have asked an order item question and asked them to rank things, such as rank or identify what you consider the most important items are. Or I could say, hey, as an ordered item, can you show me the cascade of failure? So hypotension would typically occur, hypoventilation would occur, and then they become bradycardia, and then they go into cardiovascular collapse. So now I'm actually making sure they understand the pathophysiology of the process of deterioration happening in them. The second question, I said this has a high mortality. So again, there's a little bit of information that's intentionally put in there to realize this is a serious call. What are your priorities in therapy? Explain 3 immediate interventions. Again, this is asked on my exam as an open-ended item, although I could have easily asked them to rank priorities or go to a multiple select item. I could have then immediately said, I identify the three most important interventions you perform and give 5 or 6 choices and do a multiple response item where they check the 3 or 4 answers. And I could put them, place them on oxygen, intubate them. And I could come up with easily 5 or 6 treatments, some that are appropriate to do, but not relevant immediately. There are others that might not even be appropriate to do at all. And that would be a great multiple select item if I did not want to grade it as an open-ended or fill in the blank response item. As this case progresses, then they get presented the graphic item. In this case, they get this EKG, and it says you're evaluating the cardiac status. So I'm bringing them through a case study, and I'm teaching them in the exam. I'm actually bringing them through reasoning. So this is taught in my medical class, and I actually walk them through. Each exam has case studies on it, and I'm actually scaffolding by each exam by explaining to them the steps they should be going through and evaluating it. So this is the EKG. I present them on a 12 lead, and I could easily do a lot with this 12 lead. Based upon this 12 lead, determine the rhythm. All right, so I can easily fill in the blank. I can do a multiple choice. I could do multiple select. I could call it sinus rhythm, and then I could put, with PVCs or without PVCs. I can identify different abnormal conduction. I could do a hotspot, and I could ask a question related to this EKG and say, hey, show me on the EKG where abnormal conduction is occurring. And they would have to click a box. So there's a lot I could do that actually takes a case study and brings them through this material. All right. The important thing here is making sure we match the level of the question to the goal. What do I want to ask? What level of understanding? Sometimes I really want to know that they know epi is 0.3 and anaphylaxis, and it's IM. So that's these lower level questions, and they're okay to use. There are other times I want them to be up here in analyzing and evaluating these case studies. So using the item formats that I've taught you together with good exam writing concepts will help you evaluate students the way you need to. You consider the different scoring methods out there and determine what the purpose of these evaluations are. Is it testing them? Is it learning and development? As you saw in my samples, I'm actually teaching them through the exam, but yet still testing knowledge and information and showing that they can analyze cases. So indirectly, I've got some lower level and some upper level items, yet I'm also doing some teaching in the case study. All right. That's kind of the basics of it. Again, in the short time we have, I got a chance to present to you a variety of item types and talk about some of the pros and cons and samples of that. In terms of me, as I said, I'm at Lindenwood University. Here's my email address for the university and my office phone. So if you want to take that down or have information and want to reach out to me, you can feel free to do so. We end up running a bachelor's degree program here at the university for traditional, and we also have a continuation for licensed paramedics to finish their bachelor's degree by giving them credit for their paramedic license and then extending on. And we're looking to grow. We're adding some faculty on board as well. So there's a lot of great things we're doing, and I just gave you a snapshot of some of the types of exam items that our students are expected to be able to do and how we use alternative item formats. I will stop there and go into an opportunity for us to have question and answer. I'm going to look at the chat here and see what I missed along the way. So we've got people from all around. Look at that. All right. And the Q&A. Where does a simple drug calculation question fall on Bloom? Jonathan asked that. Usually a drug calculation question is probably more of an application, if you're applying formulas. Sometimes it's, how many pills would I give? I have 50 milligrams and I need to give 100 in each pill is 50 milligrams. It's a little bit different than treating a scenario question that says, I want to go ahead and give you a weight, a page, a dose, and then you determine whether or not how much dopamine is supposed to be given. So if I want to evaluate whether they know the normal doses of dopamine and can actually do a drug calculation, and I don't actually give them the range of dopamine and the drug calculation, and all I give them is weight, or I have to have them delineate whether or not dopamine is the right drug to use, then it becomes a higher level question. But if I just said, hey, what is the normal dose of epinephrine? It's a pretty knowledge-based, a low-level knowledge question. Without endorsement of other specific software programs that can be used to develop online quizzes with several types of questions. Yes. For many years, I used Respondus was a product that one of the community colleges I taught at had that was used as a plugin that we would work with our learning management system. My college uses Canvas as our learning management system. I believe Blackboard has a lot of this built into. Canvas is a tool that I wrote many of my items for this presentation in, and now they have these alternative item formats that are even more than what I've presented to you in the newest version of the Canvas quizzes. So I would check with if you use a learning management system. There are some other commercial, I think ExamSoft and there's one or two other companies out there that actually have software designed for writing exams. And many of them have these different formats. Many of them want you to subscribe and use their computerized delivery engine as well. So that's where the cost comes in, not just only writing it, but delivering the exam through their platform. All right. Other questions? I tried to stay within the 45 minute to 50 minutes, so I had questions, hoping there'd be a few more, but we're doing really well on time. We hit the 50-minute mark for one CE. Do you use any written exams where spelling and handwriting are graded? Yes, Cheryl asked that question. If I'm my assessment class, for example, if I identify a condition, sometimes people don't know how to spell words. And if it's relevant, I will downgrade or mark incorrectly if you don't spell the word correctly. Go back to the neck issue, the goiter. Hypo and hyperthyroidism is one of those things that if you use hyper instead of hypo, you're going to be wrong. But on the other hand, if they talk about, certain conditions, I've got to be prepared to be able to use that. I will expect and delineate to students up front that spelling does count. Handwriting, because I do a lot of my stuff computerized, I don't deal a lot with handwriting. Because these are open-ended items that are on a computer, they have to type. So I don't usually run into handwriting issues as much as I do. Spelling, at some point in time, you've got to be able to write it, because I do teach a medical documentation class. In my medical documentation class, they will write PCRs and they will be downgraded for spelling, because that's professionalism. If you can't spell a word correctly, that's a problem. Let me give you one example I often use in my medical documentation class. It's bilirubin. Bilirubin is part of a lab, and somebody wrote in a PCR bilirubin, B-I-L-L-Y space Rubin, R-E-U-B-E-N. Well, bilirubin is not the name of somebody. It's actually the name of a lab, and it's a test that happens with the liver that gets produced there. So in that case, I would mark them incorrect because it hurts their professionalism. Dean wrote, does NAEMSE recommend creating questions with more than one correct answer? I was informed that National Registry was switching to this format. National Registry did start adding what they call technologically advanced type items. The multiple select, I think, was the first item type that it started popping up. I have heard EMT and paramedic students tell me that they have seen those items before. I believe the graphic items or maybe the ordering items are probably coming in due time. So I think there's more coming on that. Big thing is remember what the purpose of your exam is. And the National Registry is a credentialing exam. So there's research out there that they got to be able to defensible on these items. The National Nursing NCLEX uses many of these item types and have been doing it for many, many, many years. And I believe that's what we're going to see with Registry, moving away from just standard multiple choice to adding more of these alternate item types within their exams. It looks like we're down to the last couple minutes. Any last questions as we wind down? And I don't see anything else in the Q&A area. Should questions include truth or answers? The other four: knowledge, understanding. Not sure I understand what Sherry wrote. I'm gonna kind of jump off the point I think that might be being asked. Some questions that are not necessarily good items to use are all of the above, none of the above. So what I often do with all of the above and none of the above is I move to a multiple response item. Instead of, A, B, C, and then all of the above, that's a perfect item that if you have those to move to a multiple response that says choose all that apply or choose the best three or the best four. So that's an example of an item that we often do poorly that we could actually use this alternate item type to do much better. A lot of us write knowledge-based questions, but as we move up and try to push higher order thinking, we're going to have to be more creative in how we write the questions to get us to those higher level items. And I think having a toolkit of these alternative item formats will help us pick the right item type that will get to the goal that we're looking at. So that's kind of my big message here at the end is, look at the goal of what your evaluation is. What are you trying to achieve? What information you're trying to seek, and what item type best helps you get there. Because multiple choice is like putting a square peg through a round hole sometimes, and we try to force it. All right. Well, for the sake of time, I got 1:59 my time, 2:59 East Coast. So I think we're going to get everybody out on time.
All right. That was fantastic. Thank you so much, Darrell. We really appreciate it. Thank you to everybody that asked questions. That was very engaging. In case any of our attendees missed it, I sent the link to register for your certificate in the chat. But if you missed it there, it will be in your Zoom follow-up email tomorrow. So I think we're good, if you're good.
All right. No, good. Thank you very much.
Perfect.
Everybody have a good afternoon.
You too.
All right. Bye-bye.
Bye.